Okay, thank you so much for coming. I'm Lisa Hark, and I'm the director of the Glaucoma Research Center, which is on the same floor on 11 in the back, where we have a whole glaucoma research center. And we have a 50-year history, starting with Dr. Spaeth, who many of you know. We've been doing glaucoma research for a long time, participating in a lot of different trials, and we also design our own trials. We're also managed the Glaucoma Research Center by Dr. Michael Weisborg. All the physicians are involved, Dr. Moster, who you heard this morning, Dr. Myers, Dr. Katz, Mantravati, Fudenberg, Dr. Richmond, and we have several glaucoma research fellows. That's Sophie, Lynn, and Cameron. We also have a very large research staff, which all need to be supported. They're supported by private donors like yourselves, by patients, by also research grants from companies and federal grants such as our Centers for Disease Control studies, and we have NIH funding as well. So we have a very large research team. Cheryl Wizoff is out here today, and without these people, Deb, you also met this morning, we could not do research. So we're very thankful, and we have an amazing team. If you are participating in research at Wills in the Glaucoma Research Center, you'll be interacting with many of these people. How many of you have done any research studies with us? Okay, excellent. So we would love for all of your hands to go up. It's not scary. It's actually really fun, and I'm going to walk you through some of the things that are going on. So why do you want to get involved in research, and what's going on with us? So we're learning new ways to detect and test for glaucoma, okay? So for example, we're going out into the community and we're using a handheld camera to take a photograph of that optic nerve that Dr. Meyer showed in the first slide. And we're shooting those images back to Wills, and our doctors are reading them. So that's a new way to detect. CDC is funding that study for over $3 million. It's called teleophthalmology. We can do it for the retina, but we are just on the beginning research for glaucoma. And we're learning how to better treat glaucoma. So, for example, Dr. Fudenberg was talking about the gadgets that were put in people's eyes to deliver the medication. So, again, we may be wanting to try some of those devices. We're also looking to identify people earlier with glaucoma. So, for example, Dr. Moster mentioned that 50% of the people on the planet, that in the U.S. at least, that have glaucoma don't even know they have it. So by doing screenings and early detection like we're doing upstairs today and in the community, very, very helpful. We also are helping the community. Improving access to care is a really big problem. People don't know where to go. People with glaucoma, because you don't know you have glaucoma until more advanced disease, it's very important that we try to identify people earlier and help them to get into care. And we are doing also research with Deb Robinson. We have several funded studies now, and we need your help with that. So if you do see Deb, she will ask you if you'd like to participate in a research study. And all that is basically doing one questionnaire up front with her, participating with her for whatever resources that she would like to work with you on, and then assessing how you did after 6 months. Because there are really no glaucoma social workers in any glaucoma services in the country. So this is a very unique opportunity, and we want to be able to publish, the great work that Debbie's doing. So at lunch on the table are the sign-up sheets for to see Deb as well as to be part of research. How does it benefit you? Well, you're going to get a full comprehensive eye exam by our glaucoma specialist, and there's usually no charge for that. So if maybe you really only want to come once a year, but this being involved in a study would allow you to come 1 or 2 more times during the year to have your pressure checked and have an exam, you can do that. We have the eye exams are held in at Wills on the 11th floor, but we're also now doing community outreach, and a lot of our studies involve people in the community. So we're at YMCAs, we're in primary care offices all around Philadelphia, we're also in health centers. We're also testing some new devices such as an EEG or VEP they call it, which stands for Visual Evoke Potential. So we hook up some electrodes here, you don't feel it, there's no pain, and we watch the waves of your brain waves and your visual pathway waves when you look at, let's say, a computer screen, such as looking at different colors on the screen, and we measure how this activates these devices. So we're doing genetic testing on people. Sometimes we may take blood for that. And we have lots of other tests that we're doing, maybe a new OCT test. How many of you have had an OCT and know what that is? So that's pretty much like an MRI of your brain. Remember the slide that Dr. Myers showed with that, they call it the that part of the trabecular meshwork. So that fancy picture of that luminous compressa, I think he called it, that we can actually measure that. So there are new MRI tests of the eye that you may be able to participate in. And many of our studies offer $25 to $50, sometimes $75 for every visit that you come in. So there could be some compensation. This is the handheld camera here that I was referring to. This is Jeannie Melanow, and that's a patient in the community. This is obviously, you know, the visual field machine. There's the state-of-the-art one, which is called Octopus, but there's new ones coming out that the companies want us to try. And so it's great for you to be involved in helping us to try those. And that's Dr. Myers examining a patient in the community, checking the pressure. We are recruiting patients from all over the city. So if you live in an assisted living facility or an independent care facility, or you have a group that you work with or volunteer with and that you'd like to help us spread the word, we're always in need to recruit people into our studies. So this is just an example of some maps that we provide in our grants. I wanted to share with you the great benefit of being involved in research and show you some of the things that we've done. This is a CDC study that we just finished in 2015. We examined 1,649 people in the community. They were over 50, age 50. About 80% of them were African American, another 10 to 15% were white, and a few Asian as well. And what we found is that a total of 44% of the 1,600, that's about 750 people, had some type of glaucoma. And what I want to bring to your attention is that we know, I'm not sure, you heard a lot of things about 3.5 million from Dr. Myers and Dr. Moster. Glaucoma is prevalent in about 2% of the population. In high-risk patients, such as African Americans, Hispanic, and Asians, and older people over 65, it's about 10%. In Philadelphia alone, we're finding 44% have some type of glaucoma. If you take away the 6% that have existing glaucoma, you still get to be around 39% just in Philadelphia. Huge numbers. And so this is why the CDC has funded us for another study to look at the benefit of a social worker to help people to get into care. This is another study that Deb is working on. She has a lot on her plate. But I just want to show you the importance of being involved in research studies and helping us to get additional funding. If any of you are in a position to contribute to the research, it's wonderful. So this was a senior center, West Oak Lane. The patient, 2 different patients said, I did not know anything about glaucoma before today's eye exam. Now I know that I'm at risk for glaucoma and I need to follow up. A lot of our research is building awareness, building education, and the other quote is the staff, which was our huge list of staff that I showed you, seemed to take a personal interest in my health. The team gave me more thorough exam than any other location. They relieved a lot of stress I had going to the eye doctor, and care like this will help more seniors get recommended eye care. So that was our community intervention, so you know what we're doing. We feel like we're doing really great things in the community. So our research is become how to improve access to eye care, how to improve treatment, and the several other things I showed you. A very important part of getting funded for future studies and helping us to grow our glaucoma research is being able to publish. So we've published over 100 manuscripts over the past 5 years, which is a significant amount of papers. These are all the glaucoma journals. We have 35 medical students that spend time with us over the summer. About 27 of them are coming from Jefferson this summer, starting June 13th. So we're very active with medical education. And the students all help prepare these papers. These are just some of the examples of the papers and all the doctors. And it's a very important part of academic medicine and research is to be able to publish your work. So I'm hoping that all of you can get involved in some tiny way of research. We have studies that are one visit. We have studies that are a year long where you come 5 times. The sky's the limit. So we don't have any specific studies that we're recruiting for today, but if you could put your name on that list that's at lunch with your name and phone number. Here's also 928-3123 is Mary Jo Schwartz, and you can always reach out to her. Do I have any questions about anything? Yes. You can stand up or just use the mic. Yeah. No, this gentleman, you had a question?
I'm wondering if there's research being done on repairing the optic nerve using patients' own stem cells. Is that too far out? Or
that's a good question. I'm not sure. I can ask Dr. Myers and get back to you in 20 minutes. You know, the optic nerve is very difficult to study because we have to have cadavers or we have to have, eye bank, like someone had their eye enucleated and taken out. They do research in rabbits and various other animals. I'm not sure about the stem cells, but I can definitely get Dr. Myers to comment on that when he comes back down.
I think I read something somewhere that there's some research going on in that area for damage to an optic nerve from macular degeneration.
Degeneration, yeah.
And that's why I was asking if there's really is any substance to that.
Yeah.
Thank you.
Well, again, taking your drops religiously every day on time, use your phone, use your reminders, coming to your appointments, eating healthy, getting enough exercise, all of those things, Dr. Spaeth is going to talk about that, all contribute to good care. Mm-hmm.